Back pain is a common disease, common in many people. The sedentary lifestyle is making the disease tend to rejuvenate. There are many causes of back pain. Patients need to find the right cause to cure this disease. Back pain can turn into nightmares that are out of patient control. It not only affects the quality of life but also devastates each person's health. Many people often ignore the symptoms of back pain as very dangerous because this can be the cause of a disease other than joints. Before thinking about any possible illness, eliminate the top causes of back pain below. Through clinical studies and practical treatment, medical experts have listed the top 10 causes considered culprits of common back pain. Due to injury or sprain. When sprained or injured spinal cord, patients may not feel pain immediately. The patient may have a lot of pain after a heavy carrying, which may be due to a sprain or ligament dilatation due to trauma. However, clinically, old or injured wounds leading to sprains are thought to be a common cause of back pain. Spinal disc herniation. Disc herniation is a phenomenon where the disc is moved out of position inside the vertebrae, usually after trauma or on the degenerated, cracked disc background. Patients often suffer from back pain. Spinal disc herniation can occur in any part of the spine, but the most common is a low-grade herniated disc, which in this case causes lumbago. Sometimes a hernia presses on the nerve that causes pain to spread down the leg. Unlike sprains in the spine, one can feel the kind of pain caused by a herniated disc immediately. Back pain caused by a herniated disc is usually diagnosed through an X-ray or MRI. Fractures in the spine can be one of the most prominent causes of back pain. However, pain from fractures is often different from chronic back pain, which often has a burning sensation. If the fracture only results in a prolonged dull ache, young people often ignore this symptom because they think it is the result of an accident. But for older people, bone healing is difficult and time-consuming, requiring a permanent cast or cast. Patients with spinal fractures often become chronic back pain patients even after surgery or treatment. Osteoarthritis. Osteoarthritis is a common problem in middle age, mainly occurs in women than men. The disease has dozens of types, but mostly osteoarthritis and inflammatory arthritis. This condition occurs due to osteoarthritis, synovial fluid, especially in the cold season, causing joint pain and arthritis to increase. Treatment for arthritis depends on the cause of the problem, which can be prescribed by a doctor, physical therapy or surgery. Pregnant. It is common for women to have periods or to have periods when their periods are painful. Due to excessive pressure on the spine, back pain is very common for many pregnant women, especially in the late stages of pregnancy. In addition to intestinal infections, kidney, ureter, bladder patients also feel acute or chronic back pain. Fibromyalgia. Fibromyalgia. This is a leading factor in causing severe back pain, which can cause whole body pain. Fibromyalgia syndrome is a chronic pain condition in the muscles, ligaments, tendons and soft bodies of the body. Fibromyalgia is often accompanied by feelings of fatigue, insomnia, or depression but no physical damage to muscles, bones or joints. Pain usually increases after a long period of heavy work. The disease does not affect life and health but affects the quality of life of the patient. This syndrome is common in people with chronic arthritis. In order to treat this disease, in addition to painkillers, muscle relaxants, patients can be given physical therapy. Practice is also very effective. Fat. If you are obese, you are also at higher risk for back pain. Increasing fat accumulation in the body puts pressure on the spine, causing back pain. The only remedy for this type of disease is weight loss. Maintain a diet that reduces fat and exercise to bring the weight to the appropriate number. It should be noted that weight loss for people with obesity must be gradual, avoid abrupt because if excessive weight loss causes back pain increased. Due to anxiety and stress, modern life makes people more anxious and stressed. Moreover, improper lifestyle and diet cause many health disorders including back pain. The disease usually occurs when nerves inside the spine are not getting enough oxygen due to excessive stress, or the use of painkillers that does not work to make the patient nervous, aches even more pain. Sleeping. Incorrect posture. Sometimes abnormal sleeping postures can be one of the causes of back pain. For example, sleeping on the stomach or when sleeping head is not straight with the neck, it put more pressure on the spine. The pain of sleeping in the wrong posture is temporary, but it becomes chronic if you do not change your sleeping position. The best way to sleep is to lie on your back, lying on your back, which is the best position for the musculoskeletal system. Sitting too much. The habit of sitting a lot for a long time is most common for office workers. This can be very harmful to your spinal health and functioning. You should rest for at least 10 minutes every hour and move around to avoid back pain.